Hey guys, Dr. Andrew here, and what we're going to talk through today is how to relieve or reduce the likelihood that you get pain on the inside of your shin. So if you've ever heard the term shin splints before, or maybe you've been running or doing a jumping activity and you're getting pain here on this inside lower portion of your shin, that's usually what we call shin splints, okay? And the culprit really in this is this muscle on the back side of our tibia or of our shin bone called our posterior tibialis. So we'll call it the posterior tib. So how you're going to find this muscle is prop your leg up like I have here. Take your thumbs and find that nice sort of pointy edge of your shin bone, and you're going to slide your fingers off the back side. And you see I'm about a third of the way up my shin here, not quite to the middle. And right as you get off the back side of that bone, you're going to feel this muscle. Okay, so that's called your posterior tib. And you may feel it feels a little tight, could be a little bit tender as you put pressure on it. So what we're going to show you is a immobilization, okay, where we're going to use a lacrosse ball just since it's a little bit tacky or sticky on the outside, and it'll grip the skin. So what we're going to do is we're going to take this lacrosse ball and get it right onto that posterior tib muscle, and we're going to sort of push down and twist to create a little, we're going to take up the slack of the skin, okay? So we're going to push down and twist, and you can see it sort of grips my skin. And then just to add a little bit more tension, I'm going to pull upward, and that's going to really lock that ball in place, okay? Then what I'm going to do to sort of work out or mobilize that tissue is I'm going to pump my foot back and forth. Now, when I do that, it's a little bit uncomfortable, okay, because I'm working in that muscle pretty firmly. So you're going to pump back and forth maybe about 10 times, okay? And then what we're going to do is we're going to work our way along that muscle. So we're going to move the ball to a new place. Same thing, twist, little pull up, pump back and forth. And we're going to work our way up the shin. You know, that muscle stops up in this area, so sort of work your way up and down the inner portion of the shin. Ideally doing this on both sides if both sides bother you, or even if they don't. This is a great sort of maintenance technique too to try and prevent or make sure you don't develop any pain here. This posterior tib muscle undergoes a lot of strain while we're running, jumping, doing activities up on our feet, especially those that involve some kind of impact. So give this a try, find a lacrosse ball, and go to work. Let's see what you think.